Good morning and welcome back to the channel. Hope that everybody is doing well as always. So I intended to do another day in the life at the urgent care. Those videos are easy for me to film and people seem to like them. But anyway, so what I was saying was I planned on doing another video of a day in the life at the urgent care, and I did get some footage from my last shift, but things got like super busy and it was just not practical for me to pick up the camera anymore. So I got only a few minutes. I am going to show you a little clip because it ties into really well the topic that I want to talk to you guys about today. And that is limitations of working in the urgent care. I feel like I've pretty much spoke positively about working in the urgent care. And this isn't really a negative, but it is a limitation, I guess you could say, of working in the urgent care setting. And so I'm only going to discuss one. This is the one that really stands out to me and one that I think you should take into account when working at urgent care, and that is its limitations in continuity of care. So what do I mean by that? So when you're working in the urgent care setting, the general idea is that you aren't going to see these patients again. Not like primary care. Primary care, you can come there with a complaint and they might not give you an answer that day. They might draw labs, they might order some imaging or refer you somewhere. They don't always have to have an answer that day. They can do all these tests, they can order these tests and wait and follow up on them and give them an answer once they get to look at a bigger picture. Working in the urgent care setting, generally, the idea is that you aren't going to see these patients again. And so follow-up or continuity of care, generally that's very limited. Well, patients come to the urgent care expecting an answer that day or expecting a solution that day. So there are some drawbacks to that. One being sometimes it can be difficult with antibiotic stewardship. Again, limited with our follow-up or continuity of care. And so oftentimes there will be a lower threshold for prescribing antibiotics in the urgent care setting, where the primary care provider might actually say to them, call me back in a couple of days. If you're not getting any better, I'll call you an antibiotic. Let's try conservative management first. That is easier from the primary care standpoint, whereas in the urgent care, patients are coming there and they want a solution right then and there. And it really depends on how you are and how you handle these situations. I'm not going to lie to you and say that I never prescribe antibiotics. I will educate the patient on the potential negative side effects of taking antibiotics when they are not indicated. For example, a lot of GI side effects, unwanted like C. diff. And then I'll also chart that in their, like in the, maybe not in the HPI, but like the assessment and plan, somewhere in the chart, educated the patient on taking antibiotics inappropriately. And oftentimes I will also encourage the patient to try and do conservative management for the next 48 hours. And then if they're not improving, okay, fine, then start the antibiotic. So I'll send them with the antibiotic and the instructions to wait those 48 hours and see if with just conservative management, see if they're improving. That's a constant challenge working in the urgent care. I would not say again that it's a negative. You just have to know that going in and be prepared with how you are going to handle these situations, because patients always want antibiotics for everything, sometimes it seems. And so it really takes some strategic wording and I guess confidence in your knowledge. It helps if you can explain to the patient why antibiotics aren't indicated. And if you can break it down from like a science-based, evidence-based practice, this is what it says, this is why they are not indicated. From the primary care standpoint, they can say like, why don't we run some tests? Why don't we try this first? If you're not getting better, call me up, I'll send you an antibiotic. So in that regard, it's a little bit easier. On the same note then, my recommendation for you working in an urgent care setting is know your limitations with continuity of care and do not order anything that will be difficult for you to follow up on, especially something emergently. So for example, working in the urgent care that I am at currently, I can order troponins and D-dimer, and I can even order the stat. That being said, I think that if you need to order a troponin or a D-dimer stat in the urgent care, if you are thinking that that is indicated, then I think that they should go to the hospital. If you do find something and they need, it's just like, why waste time? Why not send them to the hospital? That is what the ER is for. If you are considering something like some kind of like cardiac ischemia or a PE, that is perfectly appropriate to send that patient to the ER. Don't put the patient at risk. Don't put your license at risk. So I think in those situations, know your limitations with following up. My urgent care, for example, I have only one time ordered a stat D-dimer, and this was a very specific patient case. This patient, I was highly suspicious of her having a PE, and she did not want to go to the hospital for religious purposes. So I even talked to her primary care on the phone. We were in cahoots. Her PCP and I were working basically together, and I told her the plan that I was ordering a stat D-dimer in our office. Those come back within 4 hours, and we were going to then contact the patient and see what the plan of action was from there. Otherwise, in the situations where I thought a stat D-dimer or a stat troponin were indicated, then those patients were going to the hospital. Truth be told, it's only been like a handful of times. It's not that often that happens, but when it does, I just think it's better to send them to the hospital. So this, of course, applies to other things too, like imaging. I've had a patient that was a fall on thinners, did hit their head, and they wanted me to just write them a script for a CT of their head. Of course, I declined writing this script because, again, my continuity of care, I want to have to follow up on that if they do find some kind of bleed. You know, that is better handled in the ER, again, where they can find out right there, have a read right there, and if needed, treat the patient right there. I've also had patients just request things like CT of their chest, have me write them a script to go get a CT of their chest. I've had a couple like bizarre requests for when patients would come in and ask me to write scripts for imaging that really obviously would be much more appropriately managed with primary care. And again, I don't do that because I am not following up on that. I'm not going to treat, I'm not going to manage anything that I find. And what they need to do is they need to go to their primary care provider. If they don't have a primary care provider, then I will help them establish one. So those are kind of just the limitations or challenges working in the urgent care, is getting comfortable with what you are able to follow up on and with what requires either a higher level of care or referral back to PCP, and just acknowledging those limitations and educating the patients on those limitations so they understand it's not personal.
It's just limitations with continuity of care. Working in an urgent care setting is better managed with primary care providers who can follow up on their patients.
It's better for the patient. It's better for the provider. I haven't really had any like real issues with it. Generally, people are pretty understanding. So it's kind of just finding what you're comfortable with, making sure that you chart appropriately. And anyway, so I'm going to show you just a little clip from my last shift because it kind of ties in with, so in our urgent care, we do try to have as much follow up with our urgent care patients as possible. We generally call all of our patients back. We definitely call all of our patients back with abnormal findings, especially if they weren't treated appropriately in the office. Those are always the first patients that we call back. And so that actually falls predominantly on the providers. Sometimes we have a nurse that also works in our office and she will do those callbacks as well. So we do have some follow-up. That being said, again, I wouldn't order anything emergently. If it's an emergent stat order lab, then if something comes back abnormal, that may require emergent treatment, right? So time is always a huge factor in medicine, depending on what it is that you're concerned for. What I'm saying is that we do try really hard to have some follow-up with our patients. They always are so grateful to hear from us that we're calling back just to see that they're improving as expected, or maybe they're not improving, and so you educate them that they should either follow up with their PCP or come back into the clinic. And so I guess the overarching theme of this is that if you're working in an urgent care setting, you're ordering something that would possibly require emergent treatment, those patients should definitely be sent to a higher level of care. So on this day when I got to work, there wasn't anyone waiting to be seen just then for the urgent care. So first thing I did was review the labs and radiology reports that were on my desk from previous patient visits. Not all of which were my patients, but whoever is on staff that day for the urgent care is expected to not only review these labs, but also to call back on them if they're able to, depending of course on how busy the urgent care is. For example, on this day, I was only able to make a few phone calls before I was quickly too busy with my patient load. Hi Hi, this is Brittany calling from. I was the nurse practitioner that took care of you 3 days ago, it looks like. How are you doing? How are you feeling? Okay, that's wonderful to hear. So because the culture did come back positive, the antibiotic that we have you on should be covering it. Just want to make sure that you're feeling better and that you're doing better. I remember you telling me you were very uncomfortable though. Well, that's good. That's definitely that's an improvement. Yeah, no, of course. And then after talking with the patient, I make a quick note on the report saying something like, spoke with the patient and their symptoms are improving, or perhaps following up with their primary care, whatever it is that might be going on. But it's a very brief note, typically just one sentence, and then I sign and date it. I'm also just interested to know, if you work in like an urgent care setting, do you guys call your patients back, your urgent care patients? Do you guys follow up with those? Just curious to hear what other people do if you are also working in urgent care, how you guys manage that. I think it's great that we try and follow up with our patients. I do. Sometimes it's challenging because we are very busy and there's usually at max 2 providers for the urgent care on staff. If it's one provider, it's very difficult if we're busy and nearly impossible. And if there's 2 providers, sometimes you can, one provider sees patients while the other one calls or whatnot. But still, it can be a little challenging following up on all these patients. But I see the importance of it, especially, obviously, if the patient had anything abnormal, especially if they were not managed appropriately in the office. If there was something that wasn't caught on x-ray and the radiologist read a fracture, have them come back in to be splinted or follow up with orthopedic, or if something came back positive on culture, and antibiotics are indicated, call them back and put them on antibiotics if they weren't already treated with antibiotics preemptively. So, there's definitely a great importance to having follow-up and continuity of care, but it is difficult working in the urgent care setting. So let me know what you guys think. As always, I wish you guys nothing but the best. Leave in the comments down below if you work at urgent care and what your process is for continuity of care and following up with patients. Do you, don't you? Let me know. As always, don't forget to like this video, subscribe to the channel, and I'll talk to you guys very soon.